child in the 1970s, a child in 2013. The difference shows up when the child steps on the scale. Childhood obesity has tripled since the 1970s. Why should we care? Obesity is linked to diabetes, high blood pressure, depression, anxiety, and poor academic performance. According to the Centers for Disease Control, socioeconomic factors can be responsible for obesity in children. Studies show children from low-income backgrounds are at a higher risk of gaining excess weight. But what is obesity? Generally, a child not considered obese until the weight is at least 10% higher than what is recommended for their height and body type. Obesity most commonly begins between the ages of 5 or 6 or during adolescence. Studies have shown that a child who is obese between the ages of 10 and 13 has an 80% chance of becoming an obese adult, which is a staggering number. The solution to childhood obesity is getting kids to start moving. Motivation is key. Eat healthy and exercise. Exercise can be fun. In contrast to the teenager who needs to lose weight, there is the teenager who wants to increase his fitness levels and bulk up, get big, gain that size, gain that muscle. What advice? Such as soccer. The Macon County Health Department has staff willing to help young people who are struggling with childhood obesity. I'm James Zoost reporting.
The dietary recommendations for teenagers is a well-balanced diet of fruits and vegetables, whole grains, protein-rich, and low-fat dairy products. The common pitfalls that teenagers experience, I feel, is lack of knowledge. While I feel that they are educated on diet and exercise through classes, I don't feel like they are educated on these two subjects enough. Giving kids the correct and up-to-date information about diet and exercise at an early age will only hopefully help them live a longer life. Say motivation is key. In order for anyone to lose weight, the person has to be motivated, and they have to want to eat healthy, and they have to want to exercise. The two go hand in hand, and you really need both of them in order to lose weight. The psychological impact on a teenager being overweight is huge. I'm sure it's hard for a teen to be overweight. At that age, kids, they start teasing each other about being overweight. Many overweight teens feel that they are unattractive and they develop low self-esteem. They consistently think that others are talking about their appearance and they don't like to be seen in public. They have feelings of discrimination and disrespect. All of these feelings may cause them to turn to food, which in turn only creates a wheel. Therefore, the psychological impact on an overweight teen is huge. Depending on what age the teen is, it might be okay, especially the later years for a teen, especially a teen who is in sports. It might be okay for them to bulk up and put on more muscle, but definitely not a young teen who is still growing. The bones, the ligaments, the joints are still growing and developing, so it wouldn't be good for a teen a teen of, like, say, 13, 14 to be lifting weights. I think when they hear the word bulk up, they may get ideas in their heads that aren't healthy ways. They're introduced to toys such as G.I. Joe, and then for little girls, they're introduced to the Barbie. I think that is what they think that the norm is, and they think that they should grow up looking like that. However, that's not the case. There have been changes made to these figurines. The G.I. Joe's bicep in 1960 measured 12 inches, and in 2001 it measured 27 inches. And if Barbie were real, she would be 5'9", have a 39-inch bust, an 18-inch waist, and 33-inch hips, and a shoe size of a 3. All unrealistic measurements. It's sad to say that this is what we are teaching our kids. For me, I've always been a natural girl, and I honestly think that that's the best way to go about it. So again, I would say going natural is the best way to go about bulking up. And after all, someone should be way prouder to sport a natural muscular body than someone who has used supplements in order to look bulk. It is recommended that young people get aerobic exercise for at least 60 minutes per day. 3 of those days a week should be strength training, such as sit-ups and push-ups, and then 3 days should also be bone strengthening exercises, such as running and jogging, and maybe sports like soccer and volleyball. There are numerous proven benefits beyond just burning calories for exercise. Exercise is proven to help a person's psychological and psychosocial well-being. It also decreases the chances of like heart disease, cancer, diabetes, any of those forms of disease. It also it proves to help people sleep better. It also can help someone who's suffering from depression or anxiety. And also, exercise can be fun.
For the interview, it's been a pleasure.
Thank you.